The coronavirus strikes, a whole mess of UK leadership, and we've got cases exploding all over the place. And of course, the United States is now the world's #1 country in terms of reported official cases. Hello, everyone. This is Chris Martinson with your daily SARS-CoV-2 update, aka the honey badger virus. Why the honey badger? Because it's really difficult to contain. If you haven't seen the video of Stuffle, the honey badger trying to break out of and being very successful, breaking out of his enclosure in a South African zoo, it's hysterical. It's very fun. But at any rate, this virus, very, very difficult to contain. You know what else is difficult? Keeping people subscribed to this YouTube channel. People keep reporting that they're getting unsubscribed, getting these reports through Twitter and through the comments that you will find beneath each of these videos. So keep resubscribing. You're going to need to do that. We are being very helpfully unhelped by YouTube and Google, who have another agenda, and part of that is unsubscribing people from this channel about as fast as they're subscribing right now. So remember to resubscribe. Going to the numbers. Yes, the big news yesterday, but of course I'm using yesterday's cases here. And so today's the 27th. This is the March 26 cases. And I'm doing that so that we can have a more complete record rather than full up-to-the-minute record. And is this meaningful? Sorta, but not really. I mean, that's a massive increase, 17,000 cases in a single day for the United States. Lots and lots of deaths. We're receiving many, many reports from hospitals all over the country that they are at the verge of being overwhelmed. And as we mentioned a couple of weeks ago, we were actually looking for this to not really peak until, say, May, possibly June. So here it is, just coming in the end of March right now. China's numbers, totally unbelievable, and we got some data behind that today, anecdotal, but it's pretty compelling, so we'll give you that. Italy still struggling, and they've been in a fairly complete lockdown for a period of time. Notice also as well how many of these are now 4-digit numbers in this column, and that's what we said we were going to do, and now we have our first 5-digit number in this column. That's the nature of this thing. We expect to see many of these move to 5 digits, possibly even 6 digits as we get towards the peak of this thing. And we hope it's a peak. We hope that there is some sort of a back off on this thing, and we hope that we have a little respite, and we hope that people develop actual immunity who've been exposed to this thing, and that it's not like the common cold virus, which is coronavirus, which can leave people immune, but just for a few months afterwards, so you get it again next year. Let's hope it's not that, because this is really just an awful, awful disease here. And let's hope scenario B is the correct one instead of scenario A, but we'll get to what that means if you don't know what I'm talking about. We'll talk about that in just a second. Spain, also coming in very strong, very nearly a 5-digit increase here, and really having a hard time bringing this down. Germany, look at this, 23 serious or critical cases. Hold on, let's check this out. Thank you so much, Mario, for bringing this to my attention here. This is in a Spiegel article. Had to read down pretty far, but right here, we see down here, we see that the number of seriously ill patients in Germany is still manageable according to the intensive care register of the DIVI. Around 940 COVID-19 patients are in intensive care units, with more than 640 have to be ventilated. So that's very different from this. So however this number is getting updated, it's wrong. It's not working out. So I think there's just a data break here. And even 940 would still be fairly low given this many cases. We would expect with 940, look at who else has got 940? The Netherlands have 761 with just a fraction of the cases of Germany, right? So what's that? Maybe a sixth of the cases. So at any rate, I think Germany's got a data reporting issue. However, to note here, there are 28,000 intensive care beds in Germany. We don't know how many of those are full on a routine basis. The United States tends to run pretty close to full because that's more cost effective on an ongoing basis. But hopefully half of those would have been free in Germany, or some amount like that, 20,000 of which can be ventilated. So that leaves a lot of room there. And further, DIVI has identified an additional 5,000 beds that could be available within 24 hours. So it looks like there's good capacity in Germany, and whatever they're doing, they are managing it pretty well. And so moving on, we see that we are still exponential. Outside of China, there's now 450,000 cases. This straight line in here is showing that every day we're still seeing an exponential increase. Again, what we're looking for is for these blue dots to begin to trail off below this other yellow line, the straight line. We'd like to see it do that. trail off like that. Okay. I want to focus now on the Philippines really quickly. They didn't show up on this table because they're really far down. See, this cuts off at 3,000 cases. Look at the Philippines down here reporting only 800 cases right now. Philippines, of course, a warm, humid environment. So we would be looking for this place to have a very slow spread, very manageable spread, something like that. But they're reporting only 9 new deaths in the daily update for yesterday. But then Jess K sent me this article out of the Bangkok Post noting that 9 doctors have died in the Philippines from the coronavirus. The country's top medical association said Thursday as hospitals were overwhelmed and medics complained about a lack of protection on the front lines. That's true everywhere, it seems. The announcement of the doctors' deaths heightened fears that the scale of the health crisis in the Philippines is much worse than is being officially reported, with the confirmed death toll at just 38. We have 54 here, so I guess this was just a little bit older than that. The main island of Luzon, home to 55 million people, is in the second week of a lockdown to contain the spread of the disease. However, medics are warning there is a surge in cases. These guys reporting the 9th doctor died. If it were up to me, test the frontliners first and test them again after 7 days. Doctors could be carriers themselves. Of course, that's absolutely true. Here's the punchline. 3 large Manila hospitals announced Wednesday they had reached full capacity and would no longer accept new coronavirus cases. So that doesn't jibe at all with what we're seeing here in the case count. So for whatever sets of reasons, don't test, don't tell, political, whatever the reasons are, a lot of countries are not being forthcoming with their actual data. The Philippines is one of them. And maybe they just don't have the capacity to test accurately, but at any rate, they are not being completely forthright about where they're at in that country. So, as I've said all along, you can't trust the China numbers. I think everybody knew that. But this is the anecdotal, pretty strong circumstantial evidence that China has been lying about the deaths, at least. Stacks of urns in Wuhan prompt new questions of virus's toll. Came out March 27th. That's this morning, today at 1:06 in the morning. The long lines and stacks of ash urns greeting family members of the dead at funeral homes in Wuhan are spurring questions about the true scale of coronavirus casualties at the epicenter of the outbreak, renewing pressure on a Chinese government struggling to control its containment narrative. Yeah, come on, China, just fess up. Well, come on, just give us the truth. The world deserves it. We really do. Every place deserves truth. Nothing but the truth. We need the data, whatever it is. The families of those who succumbed to the virus in the central Chinese city where the disease first emerged in December were allowed to pick up their cremated ashes at 8 local funeral homes starting this week. As they did, photos circulated on Chinese social media of thousands of urns being ferried in. So remember, China's total official count as of yesterday, it's been stuck here for a long, pretty right around here, 3,287. That's their story. That's what they're going with. Outside one funeral home, trucks shipped in about 2,500 urns on both Wednesday and Thursday, according to Chinese media outlet Caixin. Another picture published on Caixin showed 3,500 urns stacked on the ground inside. It's unclear how many of those urns had been filled, so I rather doubt that a single funeral home is going to order 6,000 urns if they only needed 500 or 600 or 1,000 or something like that. 6,000 urns at one funeral home. People who answered the phone at 6 of the 8 funeral homes in Wuhan said they either did not have data, tight-lipped, how many urns were waiting to be collected, or they were not authorized to disclose the numbers, and calls were not answered at the other 2. So that's all we got. We got photos out of 1, but one funeral home out of 8 had 6,000 urns for the dead, and allegedly there's only 3,287. Certainly, of course, there are people who are dying as a normal course of business in an 11 million person city, but not at that rate. Remember, the case fatality rate issues, we said both problems with the numerator and the denominator. So here we were just talking about China not counting things in the numerator. And of course, there could be lots of reasons the denominator is off as well. So we don't really know where we stand, but it's vitally important that we do get the data. So that's what we need. We need the data so we can actually make informed decisions. Closer to home for me, in Massachusetts, 150 Boston hospital workers now test positive for coronavirus. This is a really big blow. Major hospitals in Boston are seeing a steep rise in the number of infected workers, a doubling to more than 160 in the past 2 days. ouch, which officials believe may be more attributable to community spread than contact with infected patients. Well, that would be a double ouch. I don't know if that's supposed to make me feel better, officials. What, the hospitals are great, but where the doctors live isn't? I don't know which is worse there, honestly. I see the spin they're trying to put on that, but that doesn't feel right to me. At Mass General, so this is, I believe, voted the second best hospital in the world, 41 members of the staff have tested positive for COVID-19, a quadrupling from earlier in the week. At Brigham and Women's, 51, up from 33 2 days ago. At Tufts, 29 to 52. Boston Medical Center, 22 tested positive, more than tripling. So, yeah, this raises alarms about the ability of hospitals to meet the challenge of a deluge of patients, which not potential, it's coming, unless somehow we're different in Boston than any other place in the world. And just how strained the state's existing hospitals are is not entirely clear. When asked by the Globe, not all hospitals have released data on their coronavirus-related admissions or staff infections. Not all hospitals have released data on either how many patients they have or staff infections. Yeah, they're holding this really close to the vest, and again, we shouldn't be doing that. We should really, really honestly be releasing all the data as much as possible. And we're just fumbling along, and we see lots of comments showing up like this all over the place. I'm going to keep highlighting them every day. There's more. This is a comment that I found under a Reddit thread in response to this particular article right here. And this one says, I'm an ER nurse in California, and our staff is starting to get very worried. Our ER physicians and CCU intensivists don't stay home, even stay at home with their families anymore. We've seen a surge in symptomatic patients in the last few days. It seems like our infection prevention department changes isolation protocol and PPE equipment use every day. So much is unknown, and it's scary. Honestly, there's fantastic documents out of China that detail exactly all of these things, what the isolation protocols should be, what the test protocols should be, what your diagnostic criteria and decision trees ought to be, on and on and on. So it's really, I think, we shouldn't be fumbling along at this point in time. If you can't, don't make it up. Don't make it up. Just go look what other people have already done and works. My mom's an ER doc and has been staying at a hotel instead of at home with me because my daughter's immunocompromised. Nobody knows when she'll be back. She's with 2 other doctors there. The hotel isn't charging them, which is nice. They're saying probably months until they go home. And she's seen some shit, did nonprofit work in war-torn areas. She was working when there was a mass shooting here, but she said this is like nothing she's seen and wasn't prepared for. So is this nothing? Is it scenario B where we're making too much about nothing, shutting down a country and an economy for something that's less bad than the flu, like the Stanford professor said? Or is it more like these anecdotes are conveying something real? I'm going with these stories because these don't come from models and from somebody's thought processes. These come from actual people who are dealing with it on the front line. All right. So, lots of decisions are coming home to roost now. That's part of this. This is a time lapse of Mardi Gras held on February 25th down in New Orleans. And you just think about just all you have to have is 1 or 2 people cough walking up and down that, and you have a mass infection possibility here. Not a single mask to be seen. A little irony there with a paramedic rolling right up through the center of that crowd, I guess. And that's what it looked like for a couple of days on end. Just people drinking and having fun down there in New Orleans. And of course now, New Orleans is facing the most rapid growth of coronavirus in the world right now. So more than 2,000 confirmed cases as of Thursday. Total number of cases in all but more than the total number of cases in all but 15 states. Hospitals overwhelmed. Critical safety gear running low. You're going to read that everywhere you read about this. Now, this virus don't care. Governor Pritzker of Illinois says people who choose to attend parties, gather in groups, or go out unnecessarily are spitting in the face of healthcare workers and those working to fight the pandemic. This virus doesn't care that you're bored. And by the way, we're just getting started. If you think you're bored now, we still have a couple of months in front of us. And so if a few weeks has worn you down and you got to go out and you got to interact with other people, you're going to catch this thing. You're going to spread this thing. And it is spitting in the face, not just of healthcare workers and those fighting the pandemic, as Governor Pritzker said, which is true, but also those who are immunocompromised, those who are a little bit more frail, those who really deserve not to catch this, if at all possible. And as well, coronavirus now has struck the UK Prime Minister Boris Johnson, his health secretary, and his chief medical advisor. And of course, it was just a few days ago that the Boris Johnson was busy telling everybody proudly that he shook hands with everybody and coronavirus patients, and he felt fine about that. We'll see how he feels about this after he has his course with this. One wonders what sort of treatment he's getting, but presumably the very best in the world. And now I want to play for you something I thought was just the best 2 minutes and 20 seconds you can get on this particular case. So let's go with this now.
Normal flu, if I get that, I'm going to infect on average about 1.3, 1.4 people, okay, if there was such a division.
Yeah.
And if those 1.3, 1.4 people gave it to the next lot, that's the second time it gets passed on. By the time that's happened 10 times, I've been responsible for about 14 cases of flu. This coronavirus is very, very infectious, so every person passes it to 3. Now that doesn't sound like much of a difference, but if each of those 3 passes it to 3, and that happens at 10 layers, I have been responsible for infecting 59,000 people. Now,
I actually wasn't on top of that maths when you were doing that. Okay, that did come as a shock, yeah.
Right. Now, most people are going to feel a bit pokey or not very pokey and be just fine, but they will have spread it around. And a few will get sick at about day 10 of their illness. So they will need to come to a hospital. And when they're in a hospital, they will consume resources and time, and people will look after them quite rightly. And they will be monitored to see if they become really, really sick. Those people then come to an intensive care unit, and that's where, if you're critically ill, your life gets saved or not. And this is the issue. If we've got a limited resource, which we have, a limited number of ventilators, a limited number of doctors, a limited number of nurses, which is fine, because we can't run ourselves with a huge excess capacity all the time. If we overwhelm that, we can't provide that service of caring for these people properly.
This isn't the end of the world, is it?
No, we've got to remember that this is, I'm not going to play it down. It's going to be ugly, it's going to be horrible for a large number of people, but it will be a small number of people who get properly sick, and a smaller percentage of those, again, that need to come to an intensive care unit, and we can save the lives of a large number of those people too. But please, just remember that the best chance we can give to the people who do fall ill is if we've got enough beds and enough staff and enough kit to be able to be there for you. And if you are irresponsible enough to think that you don't mind if you get the flu, remember, it's not about you. It's about everybody else.
Yeah, it's not about you. It's about everybody else. And that's a really important concept. I thought that was just really brilliantly summarized, very, very cogent. And of course, this is all of the points that we've been making here for quite a while. Glad to see them out there right now. Glad to see them getting the airtime that they need. That's a very well done piece. And I really applaud the professor for being so clearly spoken in this particular example and very full of compassion. Very good. Well done. The other things I want to bring forward, though, is let's take a look at a couple of other cases here. And let's look here now at the Lancet. The Lancet is a medical journal. The Lancet's Richard Horton does a brilliant takedown of the government in the UK as their handling of the coronavirus issue so far as a national scandal. Let's take a quick listen here.
And honestly, it's sorry to say this, but it's a national scandal. We shouldn't be in this position. We knew in the last week of January that this was coming. The message from China was absolutely clear that a new virus with pandemic potential was hitting cities. People were being admitted to hospital, admitted to intensive care units and dying, and the mortality was growing. We knew that 11 weeks ago. And then we wasted February when we could have acted. Time when we could have ramped up testing, time when we could have got personal protective equipment ready and disseminated. We didn't do it. I'm hearing that not just personal protective equipment is not available, it's the wrong kind of personal protective equipment. What we have isn't even WHO standard. We're putting our health workers, who we've just all clapped here, in the front lines without the armour they need to defend themselves. They're wearing surgical masks which are not WHO standard. They're wearing thin plastic aprons which are not standard. And they're wearing rubber gloves which only cover their wrists, exposing their arms to danger, jeopardy. That is nothing short of a national scandal. How could we allow this to happen? The hypocrisy of clapping NHS workers and yet the government not supporting them to go into that front line is tragic, and it was preventable. I'm sorry to say, but it was preventable.
Yeah, very powerful there, right? So that we shouldn't be in this position. And of course, that's the British version of it didn't have to be this way, right? And a British person emailed me after I tweeted this particular clip out and said that in to decode in British speak, this person is livid. They're very, very upset, and they're all but jumping up and down, screaming in British in British mannerism. So now we see that, yes, of course, this all should have been known by the end of January. And of course, that's what I was jumping up and down and screaming about all the way back in that last week of January, was all of these points that were just made now. And if we had followed those and used February to get ourselves more prepared, to have PPE for everybody, to have gotten started the long haul of getting the people of the country ready for the idea of the behavior changes they were going to have to undertake, from social distancing, working from home, wearing masks, personal hygiene, all of that. It takes time to adjust and things like that. And of course, we didn't adjust here in New Orleans, and now we're paying the price. And I'm just going to play this one more clip here for you. This is the New York City Health Commissioner on February 2nd.
For coronavirus is low.
Oh, let me start that again.
And that our preparedness as a city is very high. There is no reason not to take the subway, not to take the bus, not to go out to your favorite restaurant, and certainly not to miss the parade next Sunday. I'm going to be there.
Yeah, no reason not to go to the parade on February 2nd. I would expect more from a health commissioner. We had all of this data back then. So again, why do I bring all of this stuff up? It's because it's really essential that we understand the mistakes we made so that we understand how we got here. It's really important that we don't continue to make these mistakes, because this isn't that hard, right? It doesn't have to be that hard. So the one thing we know is you beat this by having everybody wear a mask. That's it. That's a simple solution to a very complex problem. If everybody's wearing a mask, then of course both the sick and the well are protected. But most importantly, the people who are sick, including the asymptomatic sick, are no longer spreading the disease because all of the sick particles are being caught right there in the face mask. So that's a pretty simple concept, but apparently it's pretty hard. So Darren, thank you. You sent this to me. Just came in today. This is out of Australia, comes from Australia ABC. Says here, face mask not recommended for healthy individuals, but essential for healthcare workers and sick people. Not sure how you distinguish between sick people and healthy people if you have an asymptomatic period. Excuse me. So coronavirus now spreading in the Australian community, but does that mean you need to wear a face mask? Well, if you're well and are not caring for a person with COVID-19, the answer is probably no. While protecting yourself from coronavirus is key to helping slow its spread, face masks are not recommended for healthy members of the general public. What? How is it not known at this point about asymptomatic spreading? How is this not a thing that you just know about there, ABC Australia? I'd love to contact me, have somebody call me and or email me, and I will send you all the data you need, because this is a inexcusably bad advice at this late stage. Masks are, however, essential for people who are suspected or confirmed of having COVID-19 or looking after someone who is unwell. And that includes frontline health workers who are facing major shortages of masks. There it is again. That if we could just lead off with that and say, hey, look, actually masks do help, but we're facing major shortages. So then when we add things up, pretty much it seems like it would be better for our frontline healthcare workers to have those, not you, the average citizen out there who may or may not be sick. I get that, but to try and tell people that masks don't help is really not good. It's just not a good thing because you're going to have to undo that because someday we will have enough masks. And then we're going to want to undo all of this. Why? Because this is how we beat this thing. Everybody wears a mask. It's not hard. But when you put out this sort of talking point stuff, which is a pretty thin attempt to shame people out of taking masks that you would otherwise rather have dedicated to the front lines of healthcare workers. And I think there isn't a person, well, very few people would not be absolutely willing to give up masks if they knew they were going to frontline workers because we knew there's a major shortage of masks and we knew that more were coming and just let us know when. So in the United States, they just passed a $2.4 trillion stimulus bill. Money everywhere. Got the stock market back up thousands of points, but not one word in that thing told me that I could find about how much money was dedicated to getting a national stockpile of masks, throwing it at whatever sorts of manufacturers might be needed, not a plan in there about how many dollars were being devoted to getting us so that we can end up looking like this before too long. Remember, if you're going to have a gold standard pandemic approach, and we are in a pandemic, you got to halt those all inbound infections. Step 1. Step 1B, face masks for everybody. I mean, I've had this out for weeks and weeks. This is it. We'll get there. It's a little astonishing why we're not there yet. All right. There's a strain of thinking out there. This is no big deal, right? That's scenario B. Or maybe it is a big deal. That's scenario A. Facebook post from a doctor working on Colorado's Eastern Plain has gone viral. It highlights concerns about a shortage in healthcare resources amid the coronavirus crisis. Dr. Daniel Snyder's post sparked hundreds of comments, thousands of shares. There's a photo taken showing him slumped over. So here's a punchline for me. About 1/3 of his COVID-19 patients, some of them in their 30s, require critical care. A patient in her 60s died. I went from saying she's doing wonderful to the next morning saying we had to intubate her. She's critically ill. Hadn't quite seen anything like that before. So that's the disease progression here. You're sort of fine. Day 8 of your symptoms, you crash if you're gonna. 8 to 10, somewhere in that zone. But look at that. 1/3 of his patients are critical, and some of them in their 30s. So this thing that it's no big deal, if you keep saying no big deal, you end up with junk like this, right? This guy is a grade A, fill in the blank here. So this is a man who thought it might be funny or whatever. He coughed on a Wegmans employee in New York, and now he's being charged with a felony. So, he thought it would be funny to go up to somebody, a worker at the store, say he had COVID, cough on them, and there was a detective in the store, and the guy promptly got arrested and charged, which is good. That's really awful. So are we facing scenario A or are we facing scenario B? Listen, I would love to be facing scenario B. I would love if that's the case. We would love it if it turns out that there's a huge number of people are already past the hump. They've been infected, didn't even know it, and already have circulating antibodies. But as I mentioned, it's really unlikely that that's happened because of the fact that we're facing this 3-day doubling time, meaning that if you had 26 million people, or in this case, 52 million people that were infected, everybody for the past 4 weeks who had gotten this would still be infected. You would still have detectable levels in there. That's a pretty safe bet. It could be as long as 7 weeks, but 4 is probably reasonable. But even if it was just 6 days, we'll go back 6 days, it would mean that out of 52 million infected people, only 6 million of them were cleared. If it was just a 6-day window where people would get the virus, stop shedding it, have antibodies, have it no longer be detectable in a PCR test, right? But it's probably more like this. So it means that 90 plus, 95% plus are going to be showing up in a PCR test. But at any rate, how do we know? Well, we get data. And the next frontier in coronavirus testing is identifying the full scope of the pandemic, not just individual infections. This is from today, March 27th. Scientists are starting to roll out new blood tests for the coronavirus or past coronavirus infection here. A key development that, unlike the current diagnostic tests, will help pinpoint people who are immune and reveal the full scope of the pandemic. The serological tests, which rely on drawn blood, not a nasal or a throat swab, can identify people who were infected and have already recovered from COVID-19, including those who were never diagnosed, either because they didn't feel particularly sick or they couldn't get an initial test. Scientists expect those individuals will be safe from another infection for at least some time, So the test could signal who could be prioritized to return to work or serve as a frontline health worker. I think this is great. We should do this because we need to know who is safe. In fact, they should have some sort of a wristband or an armband, something they can wear, or a pin that would identify them as safe. And that would just go a long, long way. That would be really helpful. So what the serological test is doing is they're looking for circulating antibodies in the blood of people. And if you have the antibodies, that means you were exposed to the coronavirus, you mounted an effective immunological response, you fought it off, and now you don't have any more virus in your system. So the PCR test won't detect it in you. But the serological test will say, oh, you've been exposed and now you're immune. That's wonderful. All right. So this will help us understand very quickly if it's scenario A or scenario B, because if it's scenario B and there's a lot of people in here who are, exposed and now no longer infected or infectious, that would be great to know. So the data, we need the data. So this is really good. Can't wait to see what that data says. And by the way, I would be thrilled if we're facing scenario B instead of scenario A, just to be absolutely clear about that. But we don't know if that's the case yet. And so, as I outlined yesterday, if scenario A is correct, but we're wrong, so if we choose to act if scenario A is correct, but we're wrong, and it's actually scenario B, what happens is some jobs are lost, the economy takes an unnecessary hit, right? If we had masks for everybody, we could really minimize that. And we could do triage, surgical application of stay-at-home rules. Like there's ways to manage that. But if we choose to act as if scenario B is correct and we're wrong, then the systems get overwhelmed, people die, a lot of collateral damage, the economy tanks anyway. So really from a logic standpoint, you choose A until you have data that it's actually B. And this is the data that might be coming around. All right, the conclusions for today. The U.S. is now the number one country of official cases, but China's data is being revealed now as completely bogus, which we knew. I think it's off by at least one order of magnitude, possibly two, somewhere in there between 1 and 2. Everyone should wear a mask. Wait, was I not clear about that? Let me say it again. Everyone should wear a mask. That would go a really long way towards defeating this thing. And we shouldn't be in this position, aka it didn't have to be this way. We have the British version of that now, and looks like I didn't finish my conclusions here. Yeah, so we really hope scenario B is the actual thing that we're facing now, but we don't know if that's going to be the case. And until we know that's the case for sure, we have to pretend as if scenario A is the right scenario, which means not that many people have been infected. We're still the peak of this thing as many as a month or two in front of us. There may be another peak in the fall, and that's only if this thing goes away for the summer. The Philippines data suggests maybe it won't. And so what we really need to do is get ready for the long haul. For people who are already bored with this or don't like it, you're going to have to toughen up here. And it's going to be a marathon, not a sprint. So with that, I am taking tomorrow off and going to take a much-needed rest day. I hope the sun's out like it is right now so I can get in the garden. Hey, remember, plant your garden too. Thank you for listening, everybody. We'll see you again on Sunday.
Hi, folks. Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.